with the AQI readings crossing the 400 mark in the several parts of the city. Air pollution can lead to multiple ailments. It is known to affect the lungs, eyes, skin and heart. But let's talk about an unknown impact of air pollution. The dirty air you breathe can raise your blood sugar levels and trigger an onset of diabetes. A case of air apocalypse causing diabetes. Doctors now warn that the air we breathe may be raising blood sugar levels and worsening India's already massive diabetes burden. Fine particulate matter like PM 2.5 and other pollutants acts as endocrine disruptors. They interfere with insulin's action in liver and muscles and can directly damage the pancreatic beta cells that produce insulin. When insulin production fails and resistance rises, blood sugar levels go up, leading to diabetes. It's also important to note and understand that the oxidative stress is a major contributing factor by which air pollution leads to diabetes. Pollution can also activate the inflammatory pathways in our body. This reduces insulin sensitivity. The result is a slow but steady metabolic imbalance that can eventually manifest as diabetes. Why this particular finding is alarming? Because it is adding to India's national diabetes burden. According to the International Diabetes Federation, India had around 89.8 million adults between 20 to 79 living with diabetes in 2024, up from 61 million in 2011, making it the second most affected country after China. The figure is projected to cross 134 million by 2045 if current trends continue. On this issue, I am joined by Dr. Parjeet Kaur, Associate Director, Endocrinology and Diabetes, Medanta Hospital, and Dr. Gaurav Jain, Consultant, Internal Medicine, Endocrinology, Dharamshila Narayana Super Speciality Hospital. Thank you both of you for joining me. Let me straight away go to Dr. Parjeet Kaur. Madam, this is like truly alarming. You know, we used to think that diabetes is about genes, food, lack of activity, something which you, parts on which you could work. But air pollution, I mean to say, you have no choice.
Right. Exactly. So when we talk about lifestyle factors, we often forget there are environmental factors also influencing us. And I think air pollution is definitely playing a big role, which you're very right, we were not aware of, and that this can actually cause diabetes and also worsen the blood glucose level of people who have diabetes. So we have solid evidence on that. Actually, we have robust data. There are many studies conducted on the long-term studies, prospective studies, which have shown clearly and they have linked that long-term exposure to air pollution can lead to increased chances of developing diabetes. In fact, they have quantified also that if you are increasing this PM 2.5 pollution by 10 microgram per cubic meter, it is increasing the risk of developing diabetes by almost 20 to 25%. And in fact, we have data from India as well. A study conducted 2 years back in Chennai and Delhi. It also clearly linked high pollution with the increased incidence of diabetes. So no doubt, this is one of the factors among other lifestyle factors, and this is what we are facing right now, increasing levels of pollution in Delhi NCR specifically. One has to be aware and one needs to take care of a lot of things, which means because people who already have diabetes, their blood sugar levels are also getting worsened. So in terms of short-term exposure, when we are talking about, it's worsening the blood glucose levels of people who already have diabetes, and in long-term, of course, who are already at risk are getting diabetes early.
Okay. Yeah. Now, according to the Lancet Global Burden of Disease Study 2019, South Asia tops the global rise in diabetes linked to air pollution. It saw the burden rise by 4 times, or around 400%, highest in the world between 1990 and 2019. This is greater than the sub-Saharan Africa. Dr. Jain, can you just explain it to the viewers? How does it happen? How is air spiking your sugar levels? And what can be done to manage that, sir?
Management, we'll come to later, but how does it do it? Well, we have a lot of theories and we have a lot of data points for that. The basis of all of this is inflammation. So PM 2.5 particles can cause inflammation not only inside the lung, but in your liver, in your adipose tissue, and all across the body. And when this inflammation affects you, it produces certain cytokines or certain chemicals inside the body, which basically disrupt your body's metabolic processes. So, in trying to basically sum up a very lengthy and very scientific discussion, inflammation causes elevation of sugars inside the body by disrupting the body's capacity to use that sugar. So if you're not able to utilize that sugar tends to accumulate inside your body, accumulate in your blood, raises your blood sugar levels, and at the same time, it affects your body's capacity to utilize or actually burn out those extra carbohydrates in the body, which lead to an elevated HbA1c or diabetes, as you can actually see it. It also has also shown us that there are indirect pathways as well. So when you look at the PM10 particles which affect the liver, so again, by affecting the liver's metabolism of fat, causing more fatty livers in these patients, you can again disrupt the metabolism of the body, and in the long term, again lead to more diabetes and more other lifestyle diseases as well.
Can you just decode what inflammation is? Is it the swelling you are talking about of the organs, internal organs, Dr. Jain?
By inflammation, yes, it is not always swelling of the organ as a whole, but there are intracellular markers, or individual cells inside the body get affected by these pollutants, especially nitrous oxide and other chemical agents, which then produce certain things called chemokines and cytokines, interleukins 2, 6, 8. There are a lot of these chemicals which are there in the body. So it produces an inflammatory response, or your body's own macrophages and other cells, which are basically designed to fight infections, then start damaging your own cells which have been afflicted by these foreign pollutants. And that is what leads to a metabolic distress in the body.
So Dr. Parjeet Kaur, then what is the, this is the explanation of why diabetes is also a consequence of bad air, PM2.5 particle. But how does one deal with it? Do we require mask all the time? Do we have to be near the air purifier all the time? Or one just has to leave the NCR?
Right. So that won't be possible to leave NCR, but yes, there are many precautions which one has to take. One is the indoor and one is the outdoor.
Okay.
So outdoor, of course,
that's a very interesting point, ma'am, because a lot of theories had come about bigger indoor pollution.
Yeah. Yes. Exactly. So as far as the outdoor is concerned, because we always advise our patients or even healthy people that to go for walk 30 to 40 minutes a day, and it becomes a real challenge. And I see my patients now coming back with higher blood sugar. They say they're not able to walk, right? So as far as the outdoor walk is concerned, definitely we kind of discourage them to go outdoors for a long walks. Of course, 30 to 40 minutes is a long distance. But if possible, if they're comfortable wearing a N95 mask, which can control the PM2.5 particles, if possible, if they're comfortable, if they do not have any breathing underlying issues, then it's possible, then they can do the walks with their mask. But if it's not possible, it's advisable that they walk indoor. Now, indoor walk is again a problem there, because one may not have treadmill or a gym in the society. If it's not there, then what I advise to my patient is that at least keep on moving in the house, at least after every meal. Take 10 to 15 minutes of walk inside the house only, so that it keeps your metabolism better and blood sugars in check. So this is how we can handle, I think. But yeah, this is very unfortunate that next 2-3 months it becomes a challenge. I would say if there is a nearby gym or society, go for a treadmill walk. There is no worries as far as the knees are concerned. Go for a slow walk on a treadmill or a cycling. Any activity which is increasing your heart rate at least will be equivalent to a walk. But that's how I think.
So basically you are saying that there has to be some sort of a post-meal exercise. Whatever you have, do some little bit of exercise.
Yes, definitely. Yes.
So, okay, that's fair enough. But Dr. Jain, post-meal exercise helps you in the insulin level. But what about this particulate matter? I mean, to say, does one need to be even more careful in the next 60 days in New Delhi, NCR area?
I mean, you have to be careful. You are seeing what is happening, and this has been happening year on year for the last couple of years, and we understand that, yes.
Okay, let me ask you, what precaution do you take?
I am just using 3 basic things. 1, I am using an air purifier at home and at work. I am using my mask when I'm outside, I'm in the car, or when I'm in the hospital. And 3, I am basically making sure I have enough water. So these are the three basic
Why do you
things
say
that
enough water, sir?
just helps flush out all those cytokines and toxins that we talked about. So they
Okay.
are in the circulation, so that helps.
So basically, you're saying that having lot of water helps in polluted areas.
Having a lot of regular intake of water, I'm not saying more than enough, I'm saying 2 to 3 liters of water. And because the temperature is cooling down, you do not usually have that amount of water. You having that amount of water will allow your kidney to filter out some of those cytokines and toxins in the blood circulation, and it will reduce the inflammation that you are facing.
Okay. And before I close the show, then what should people do if they can't afford to have the air purifiers all the time? If they live in small houses, they can't take those quick walks inside the house. Then what about them? What should they be doing?
Now that is a very difficult question to answer, sir.
Why?
Sir,
And
Okay,
Again,
Dr. Parjeet, would you like to take that question?
Yes, I think we can revert to some other kind of exercises like yoga as itself is also very good if somebody can do that. Or there are a lot of online programs now which gives a 20 to 30 minutes of online workout program. Just switch it on and do it at home. I think there are ways to handle it, but people are not usually aware of it. But this is something we need to do if we are not able to do outdoor. Yeah.
So basically, you're saying that the yoga is one way in which you can manage your blood sugar, but more than that, winters, bad air, polluted. What are the precautions that senior citizens should be taking because they are the worst hit?
Exactly.
Dr.
So
Kaur.
senior citizens are definitely are worst hit more than 60 years of age, especially. So the same precautions, senior citizen definitely they should not go out for walking, even if they're masked, because mask can be difficult for them because of breathing issues. So the same advice for them at home only. If they are able to walk, it's fine. Otherwise, doing yoga or stretches or even the breathing exercises, some form of mobility can help regularizing their blood sugar levels.
Oh, absolutely, absolutely. It was a fascinating topic to talk to both of you. But it's so disturbing that even polluted air can cause something like a spike in your sugar level, because in general people think that the air pollution will cause harms to your lung, but for this study to prove that it spikes sugar level, then it infects the overall vitality of your body, because diabetes is not a disease. It's like it causes so many complications in one's lifestyle, and it's something which requires some sort of a collective action. It requires social intervention to clean air. This is not like individual diagnostics, and that's what makes it worrisome, because it requires community intervention to ensure that the air is clean, because it's not about individual and people, it's an intergenerational issue, because that's what you leave the society with, and that's what makes it even more worrisome. I thank both of you for joining me, and it is for this reason I chose this conversation with the doctors, because when we talk about bad air, we're not talking about individual health, we are talking about society, we are talking about people around us, and we are talking about larger well-being of this country, which is affected by diabetes. We are called the diabetes capital of the world, and that really needs to change. Even the Prime Minister had been talking about it. He has been continuously saying that we must reduce oil consumption. Khelo India, Fit India has been hallmark of his campaign. And I think people should pay heed to that. And this is all I had on Point today. I'll see you tomorrow at the same time. Thank you and good night.
पता है हेल्थ इंश्योरेंस आपकी फैमिली के लिए कितना जरूरी है? इतना जरूरी है कि भारत सरकार ने इस पे जीएसटी पूरी तरह से हटाकर जीरो कर दिया है। पॉलिसी बाजार पर अब 1 करोड़ का हेल्थ इंश्योरेंस सिर्फ 550 रुपए महीने से शुरू। policybazaar.com।
पढ़ता है, खेलता है, झूलता उछलता है,